So let's get started. First, I'd like to acknowledge our two special guests, Ms. Robyn Petras, who is a cystic fibrosis patient from Ohio. Welcome, Robyn.
Thank you.
And Ms. Emily Lenz, who is an asthma patient from New York. Welcome, Emily.
Thank you.
Both Emily.
Glad to be.
Thank you, Emily. Both Emily and Robyn had experience with the COVID-19 virus and are here to share their experiences with us today. Would also like to acknowledge our moderators and discussants. First, Dr. Lynn Reinke of the University of Washington and the VA Puget Sound Health System. Dr. Reinke is also an ATS leader who served on the ATS Board of Directors, chair of the ATS Nursing Assembly, the ATS Planning and Evaluation Committee, and she has done so much for the American Society. Dr. Reinke also has a PhD in nursing and a master's degree in pulmonary nursing from the University of Pittsburgh. So welcome, Dr. Reinke.
Thank you so much.
We have also with us Ms. Tonya Winders, who is the CEO of the Allergy and Asthma Network, a staunch patient advocate in the asthma community. If you're in the asthma community, you've probably heard of Tonya's name. And Tonya is also a member of the Advisory Roundtable. Welcome, Tonya.
Thank you.
And then Ms. Siri Vaeth, who is the Executive Director of the Cystic Fibrosis Research, Inc., again, another strong patient advocate in the CF community, the mother of a daughter with CF, and also a member of the ATS Public Advisory Roundtable. Welcome, Siri.
Thank you.
All right, so we're going to jump right into it. And for the folks online with us, this is really intended to be a conversation. This is not a didactic talk where we present a bunch of slides. We really want to talk with Robyn and Emily today, who's going to share their stories with us. And so I think we should start with Robyn. And Siri, if you don't mind, if you'd like to kickstart the conversation with Robyn and then allow Robyn to tell us her story and walk us through her experiences with COVID and CF. I'll just take a step back and go for it.
Well, welcome everybody. It really is a pleasure to be here. And Robyn, I'm thrilled you're here with us today. For those of you who aren't familiar with CF, it is a systemic disease, but most known for causing respiratory complications. And therefore, COVID-19 obviously created a tremendous amount of fear in our community about what the results would be should somebody with CF COVID-19. So I am really thrilled to welcome Robyn today, Robyn Petras, to tell her story. She has CF, but is also a COVID-19 survivor. So Robyn, thank you so much for being here to share your story.
Thank you for allowing me to. I thought I'd start out with a condensed version of my CF journey because that is relevant to how I tackled COVID-19. And I do want to say up front that I am only sharing my experience, and it's my experience only, so I'm not giving any advice. Today, I'm so excited. I turned 54 years old, and I'm thankful to be alive with CF at age 54. I especially give thanks to my twin sister. She was born with meconium ileus complication. Because of that, she only survived 10 days. But that led to our very early diagnosis within weeks of having CF. Back in the 60s, physicians, my family physician, did not know how to treat CF aggressively. And according to my mom, he actually discouraged them from seeking a CF specialist because at that time, I didn't experience any pulmonary issues. I did have severe digestive issues, the loose, oily stools all day, all night, malnutrition. When I was 8 years old, I only weighed 36 pounds.
Oh, my.
So I was not officially treated with CF until I was 8. And thankfully, my dear parents, on their own initiative, contacted the CF Center in Columbus, Ohio. And that is where I've been a patient ever since. That was 1974. And the expectation for CF was 12 years of age. Can you imagine being told that as a parent? It was devastating, I'm sure. Thankfully, I didn't quite understand that part at age 8. But that is when preventive lung treatments became a part of my daily life. We did albuterized nebulizers to open my airways, and then in the morning, and my mother in the morning and my father at night would do postural drainage on that 45 inclined table, and that became our ritual, as well as sleeping in a mist tent for the next 6 years. That was terrible. In thinking back, I probably guess that I started culturing staph and Pseudomonas when I was a teenager. But then my lung function remained very high. I didn't have any pulmonary issues. I actually didn't get my first major CF setback until 33 years ago today, on my birthday, when I was turning 21. I was hospitalized because I became diagnosed with CF-related diabetes. I was very sick. I started insulin that day, and I've continued to use insulin as part of my therapy. I've worn a pump for 20 years, and last year I started using a continuous glucose monitor. And with that, I've been able to really tackle the disease of diabetes along with CF. And I've learned, and I am a strong believer, that all of my body's systems work better together when they're in sync. So the better my diabetes control, the better my lungs, and vice versa. So that brings me to about my mid-20s. It was a great time of life. I was newly married, following my passion of teaching elementary school. And in that time, I also became a mother through the process of adoption. But unfortunately, at that time, my lung disease started progressing very quickly and very fiercely. Mucus and coughing became my new norm. And I recall that at that time, I could only go minutes in between coughing. So that's when that vicious cycle of inflammation and infection and mucus started spiraling out of control. I believe I had my first round of IV medication at the age of 24. And that's actually pretty old for people with CF. And since then, I've experienced, I'm going to guess, 25 rounds of IV therapy to beat down the Pseudomonas and the other bacteria that my lungs love to attract. So with this experience, I know my body really well, and thankfully my CF team has always made me feel a part of the team and has always trusted what I tell them. So I think it was on March 16th, I noticed that I woke up and I had this sporadic dry cough. And it was different than before. It was not full of mucus, and it was not an asthmatic cough from my reactive airway disease. It was a short cough that would happen 2 or 3 times in a row every couple of hours. I recall waking up in the middle of the night with this kind of cough. Didn't think much of it because I felt fine. But the next day, as I was exercising on the treadmill, I've got to give a shout out. Our governor is amazing. I was watching our governor, Michael DeWine, and he was talking about the restrictions. Our state was starting to shut down, and he talked about the symptoms. I turned off the TV, and I was exhausted mentally. I thought, I can't take this. I'm starting to, that gray cloud is now appearing again. So I went to take a nap. And within 30 minutes, I started to feel warm, and so I took my temperature. And within a very short period of time, it went from 99 to 100.5. And so I thought of a conversation I had on Sunday when I called my CF nurse. And she said, Robyn, call with any change in symptoms. And so I'm counting on my fingers, fatigue, this strange cough, and now a fever. I better call my clinic. Fortunately, they were still there. They believed me immediately. They ordered a test for COVID. And the next morning, I drove to my hospital to get this test. It was extremely safe and efficient. I stayed in my car. And from that first onset of symptoms the day before, I decided to self-quarantine because I didn't know and I didn't want to infect anybody else. When I left the test, they said, oh, this is going to take 5 days to get the results back. Well, what do I do for 5 days? So I self-isolated, and when I learned of the results, when I finally got that test result, I cried. And the gray cloud really started appearing, and I decided I was able to talk myself into reality using all those meditation techniques. I decided, hey, I can't determine how this virus is going to impact me. I can't control that, but I can control my actions and my attitude. And that was a lesson that my doctor taught me in '97. And she also taught me, and this was probably 8 years ago when my lung function kept plummeting and I didn't know why. She taught me to stop asking why, because we don't always know the answer to that. I did everything right. And I thought, why did I get COVID? And so I caught myself again, and I reframed my thinking from why me to what can I do now? And I thought about all those lessons that my CF centers taught me. And I knew that to fight COVID, first, I had to eat healthy. And I had to keep my glucose tight so that the virus didn't impact my kidneys that are vulnerable. And so I limited my carb intake, and I ate nutrient-dense foods. I drank a lot of fluid. I drank a lot of warm tea, and I ate a lot of protein. Then I went to the second memory, which was meditate. I needed to stay in that place of positivity instead of what I really wanted to do was just lie in bed and put the covers up over my head and start ruminating. Those old habits do like to creep back in. So I decided to stay present. And most importantly, because I could at the time, I decided to keep moving because I wanted to prevent pneumonia from setting in my lungs. And I felt well enough. On day 6, my fever was gone, the dry cough was gone, but then I started producing massive amounts of thick, highly infected mucus again. So my nightmare was back. I had just gotten rid of it. But I had a leg up because that was my 30-year career, clearing mucus. So I pulled out all my arsenals. I use about 8 different tools for airway clearance. And I began doing very aggressive therapy every 3 to 4 hours to keep my lungs open and cleared out. I'd actually felt much sicker with CF exacerbations in my life, and so this was just sort of part of my norm. I was able to still walk on my treadmill. I used a TRX suspension system. It's one of my favorite ways to exercise twice a day. I took extra naps to get the rest, and I did everything I knew to do to let my body recover. When I got the call, I decided to be fully transparent. I outed myself on social media. I wanted to use my COVID experience as an educational platform. The hardest part was calling my friends. I'd been with several friends. I had to call everybody that I was in contact with 14 days prior. I think it was about 4 days before the onset of my first symptom, and I hear that we're most contagious 2 days before. But thankfully it was 4 days. I tucked my dad in bed. He has severe Parkinson's. And so I was concerned about them. My dad was the last person I touched on March 14th, and I've not been able to visit them. So to my surprise, my COVID recovery was rather quick and easy compared to the stories I'm hearing, and I'm so thankful for that. My lung function did not decrease. I can check it at home. Sometimes rather obsessively. My husband has to hide that machine from me. I was not short of breath, and my infected mucus started to slow down and decrease at about the 12-day mark. So I got through the physical part, and I still had to battle with the mental part, because then guess what crept in? Survivor's guilt. I started watching the news again, and my heart started breaking for people, and I started getting call after call from around the world. And I remembered back when I was in college, and I watched my first movie about somebody dying from CF. My doctor then said, "Robyn, remember this. Do not ever compare yourself with another person again." I remembered that, so I stopped comparing myself. I stopped asking why, and I started asking, what can I do with my life now? I've been given a third chance at this. What lessons can I pass on to other people to offer love and light and hope? Because isn't that what we're all about? And last week, and I will cry on this one, last week, the FDA changed the protocol for plasma donation. And to donate plasma, first of all, it's a great time for women because it's the first time females have ever been allowed to donate plasma according to the FDA. I do have positive antibodies that were tested at the Mayo Clinic, so it's for real. It's not a set-up shop of people earning money to do COVID tests. I've really got antibodies. And the FDA also changed their protocol last week. So to donate antibodies for a person that is struggling, you either have to be 14 days past your last symptom with a negative retest, or 28 days without a retest. Well, at 21 days, I was still testing positive. I've been tested twice, and I still have a positive screen, even though I'm way past symptoms. But last Friday, the most joyful part of COVID for me was driving 2 hours to Dayton, Ohio. And I drove to the community blood bank because Dayton is about a month ahead on finding of people in Columbus for plasma donation. They started the work the week of April 1st. So after 2 tries, I went once and my veins would not cooperate because they're really tapped out. But I went back again on Friday, and I was able to donate 600 milliliters of plasma. And I got the joyful call the next morning that my plasma was found to be a match. I'm positive A person that was struggling in the hospital was able to receive my gift. And I want to end with saying that even though my COVID experience is unique to me, I'm glad to offer support to anybody. I'm really humbled to be part of this webinar, and I'm thankful for the education that this is providing. And my hope for our world is that we can stay united in love with this purpose that is greater than we can even imagine, so that we can conquer this challenge. And I hope that we can all become better because of it. And I thank you for listening to my story and for all the support I've received from around the world.
Thank you, Robyn. And, we'll come back to Robyn, and we'll have questions from the audience as well, and some specific questions probably from some of our moderators. But I want to switch to Emily and Tonya right now, and to get a little bit of take from the asthma perspective. Tonya, Emily?
Yeah, well, thank you, Courtney, and thanks to ATS and to the PAR for this opportunity. It's great to be here today. And on behalf of the 25 million Americans that are currently living with asthma, COVID-19 certainly is of great concern. And we've heard from many in our community who have been diagnosed with COVID. Thankfully, most of them have recovered. Unfortunately, we have heard from a few families who have lost loved ones due to COVID with asthma complications as a comorbidity, and also COPD as a comorbidity. But today we have the privilege of hearing from Emily Lenz, who is a severe asthma patient from the epicenter of COVID-19 here in the U.S., from New York City. And Emily, thank you, number one, for your willingness to come and to share your patient journey with us today, your personal journey with us today. I'd like for you to just share briefly about your asthma journey before COVID, and then specifically how COVID showed up in your own life.
Happy to be here today. Really amazed to hear Robyn's story. And
I laughed when you said I was born a compliant person, because I think I am as well, and that's partially why I think we're in such good shape now that we had the tools before this all happened and the tools we could draw on during and after. So I was diagnosed with asthma as a baby, I think around 18 months old, but something my mom would know much better than me. So I've been an active asthmatic nearing 40 years now. I'm a patient of Dr. Parik's, which is how I came to hear about the asthma, or get connected with the Asthma and Allergy Network. And as a child, I would say I had limitations from asthma. I had my visits to the ER. I had a few hospital stays. I had the at-home nebulizer that I used every day before I came to school. But things kind of got better after I was about 10. And so more what I'm going to talk about, I guess, is my time now when I'm an adult in charge of my own program and figuring things out on my own. So I've been with Dr. Parik for, well, her clinic and then with her for over 10 years now. I've gone there for regular allergy shots and check-ins, and for the past 3 years I've been on Xolair, Dr. Parik's recommendation, and it's been great for both the asthma and the contact dermatitis I have, because I am an allergy or an asthma and allergy sufferer. So I've been on Advair for years, and every time I tried to lower the dose, my asthma would act up. So with Xolair, I've been able to work on decreasing my Advair, and for the past 3 months, I guess, I've been on Symbicort. So going into this COVID scenario, I had kind of questions about medication. So when I last had my Xolair shot with Dr. Parik, we talked about medications, we developed a plan, and I think the benefit of that was it made me feel like before we even got into this, that I was in the best case I could be in. I had my action plan, I've been compliant, and I had done as good a job as I could to be prepared for what we all didn't know would happen. So like with Robyn, my timeline was pretty quick with COVID. My last day of work was the Thursday, the 19th, I think, or whenever Cuomo had told us that New York State would be shutting down, and we all had a few days to prepare. So I was finished that preparing. I had my first day working at home on the Friday. I thought I was in, I had everything I needed. I had my prescriptions, I had my action plan, I had my tasty food and wine, and the next day my boyfriend started feeling sick. And it was allergy suffering time, the height of it in New York, and trees were just becoming beautiful and blooming. So I told him, welcome to my life, and take a Claritin and you'll be fine, which was wrong. He spiked a fever that night, and despite all of our planning about how he was going to take care of me, I was now taking care of him, which was a different type of situation for those of us that are the sufferer. His fever was at 101.7 for 3 days. He didn't have a horrible cough. He just had terrible backache, headache, and extreme fatigue. I was okay, but had discomfort because it was the first days of quarantine in New York. And we were hearing about the horrible things that were happening in hospitals. And it was just a whole new world at the time. But he and I were taking our precautions. He wasn't touching anything in the kitchen. If he showered before I did. We were trying to do everything to minimize it happening to me. And at that time, we didn't even know if it was COVID. Getting tested in New York was you had to go to an emergency room. You had to have the fever be high enough to qualify. And it was just a scary thing. You had to be really sick to do that. And my boyfriend, while uncomfortable, was okay. We had a pulse oximeter that my uncle had insisted we buy when we all learned about COVID. So that was a great resource. I was checking his temperature and his pulse and his oxygen rate twice a day. I was checking mine too. So we knew he was sick, probably COVID, couldn't know. And then he couldn't smell anything. And I would make him tea and I'd ask him what flavor he wanted. And he was like, it doesn't matter. It's all water. And at that time I could still smell the teas because I remember smelling them and going, these are so distinct. How could you not know the difference between lavender and ginger? And as he started to get better, I stopped being able to smell. It was, I mean, now looking back on it, we know these things. At the time, it was just coming out. I still didn't know if my discomfort was allergies or sickness. I never had a fever. But during that second week, as he was getting better and I lost my smell, the weight on my chest was just horrible. I mean, there was no cough. It was just pain. And it felt to me almost like when I'd had flus before and had that horrible coughing, when everything is just tender around all your ribs. It felt like that. Now I look back and think, what was I thinking? I was so focused on being due for my allergy shots, and I was debating, will the allergy shots help make this go away because maybe it is just allergies, or do I have COVID, and if I go to my allergist, I'm going to get everybody sick. So I had a kind of sleepless night of freaking out about that. And I woke up in the morning and went, no, this is simple. I just called Dr. Parikh. So I called her. We had a chat. Her response was absolutely not. You're not coming in. You're staying at home. You are under quarantine. And that was the first time it's kind of hit me that maybe I really did have COVID and needed to be taking care of myself. I'd already been kind of in a mode, like you were saying, Robyn, of like eating only nutritious foods, lots and lots of fluids, no coffee, like nothing that might dry me out. I was trying everything, but I was still thinking like, oh, I'm doing this to prevent something more than have it. And so Dr. Parikh and I had a discussion about whether I should move to steroids because it seemed like I was having an asthma episode. I was taking my Ventolin about twice a day. And normally in allergy season, I might take it 3 times a week. So there was discomfort. And then, so we agreed, it was before the weekend, we agreed I'd see how it went over the weekend. We'd touch base again on Monday and decide there where we were going to go on steroids. And on Saturday morning, I'd had a bag of coffee that I made my boyfriend smell every day to see if his smell was coming back. And so I smelled it, and I could smell it. And it had been a week of not being able to smell or taste anything. So that was really exciting because it made me feel like I was on the up. And by the end of the day, the weight on my chest really started loosening up. And I didn't call Dr. Parikh on Monday, which was not compliant of me. I waited until Tuesday, and by Tuesday, I truly felt better. And it really, as my energy came back, it was clear that I had probably been through COVID. Neither of us ever got tested in New York because it was just
so impossible. And we were healthy enough that we didn't want to risk going to a hospital. So we're investigating antibody testing. I've signed up for, Robyn, I hear you being able to donate plasma, and that's fantastic. Like, I've volunteered for every study I can over email and haven't heard back. Hopefully that means it's because so many other people are also volunteering to help. So I think as we learn more about which antibody tests are effective, I'll get an antibody test. But kind of the way things are now, I still have to stay the course that Dr. Parikh and I developed, because who knows? So I'm still following the regimen she gave me, but I'm feeling much better now. And I hope that my story can be one of just kind of trying to reduce the fear that's out there, because I know how strong it is. Just because we're asthmatics doesn't mean it's going to be devastating. You got to take all the precautions. I mean, I only go out for food, don't do much else, or walks in the park now. But it just, yeah, I think the fear is so much that the tools we've learned to settle down, to try to settle our breathing, are all really useful things to have right now, in addition to the regimen of medications. So thank you.
Thank you, Emily. That's so powerful, and we appreciate your willingness to share and your insights about your COVID experience. I'll turn it back over to Courtney, and we'll determine how we want to move forward with questions.
Yeah, so I want to bring in Dr. Reinke, if you have any thoughts about each of these patients and their stories.
Yeah, thank you so much. Thank you both for sharing. This is so powerful. I just, actually what my comments are really apply to both you, Emily and Robyn, but I'll start off, Robyn, with you because you went first. And happy birthday. Today is actually your birthday.
Thank you.
Thank you for sharing and celebrating with us. Because of your early diagnosis and in your many years of living with CF, it sounds to me, what I like to say to my patients, is you built a really powerful toolkit of different skills to use and apply over the years, and that was exercise, physical exercise, and strict adherence to your medical regime. But most importantly, you developed coping skills or resiliency skills that I like to call about using and applying meditation and powerful and positive thinking. And I think for me, what I hear you guys saying is that over these years, those skills you really were able to apply during this situation to help you get through even a more stressful time that complicated by your COVID diagnosis. And I just wondered if you might want to share a little bit about that, because I think these are such important skills to learn and to apply and to sort of, again, have in your back pocket to pull out when you need, whether that's daily or during times of even more stress.
Thank you. I think for me, it's an awareness of staying in that present moment and using techniques that will bring me back to that, and being very aware that I am not my thoughts and I am not my feelings, but something I do often is I carry a little stone in my pocket that has a positive word on it. And when I could feel my mind going to worry, when I had COVID, I would pull that out and just simply rub it and repeat a sentence: I am strong, I am healthy. And to me, that was something that I did throughout the day, and just became very aware of just staying present. It sounds simple, it's actually hard, but being very aware of trying to substitute that future worry with something positive or present. Made a lot of phone calls. I love to talk on the phone, and so I just kept my mind busy with positive things.
Yeah, thank you. Thank you so much. And if it's okay, I'll just ask Emily a comment as well, or make a question about the same thing, Emily. I mean, since you were 8 months old, you built up this you know, you had your action plan, and you were able to put all this in place when you were diagnosed. But it's really struck me as your ongoing relationship with your physicians that helped also to guide you through this, and when you were having some stressful times making decisions about whether you should go in or be tested, and also caring for your boyfriend, you know, being able to rely on the guidance of your, you know, your medical team sounds like it is really critical.
It's, I've been thinking through this process, and I know with the Allergy and Asthma Network, it's a lot of moms who are part of the network. And in a way, we benefit, I think, from having this really early on, because early on, it's not in our hands. It's in our parents. So we get really used to it. And so then when it switches to being an adult, it's just like, well, of course I'm going to trust what my doctor says, and I'm going to do some reading and investigate and ask questions. And the other thing I guess I was thinking of when, with this talk, it was asked, could we share your story publicly? Because I've had this as a kid, I have no shame about my asthma. Mm-hmm. It's just something that's part of me. It's not a reflection of something I've done that's good or bad. It's just who I am. So I think that's another benefit of having it diagnosed really early, is there's just this, like Robyn was, this is what it is. There's no whys. There's no why could my sisters run around a lot and I struggled. It's just what it is. And having those tools and trust with the medical team you have around you definitely is helpful in a situation like this. I mean, if I didn't have my asthma in control with a regimen and a team, how panicked would I have been being in New York City March 15th? Mm-hmm. So I feel very lucky. I feel extremely lucky to have had a mild case, because that's just kind of roll of the dice. And I feel very lucky to have been in good care, so elements of that stress were minimized.
Yeah, I actually think that because both of you are so adherent and so in tune with your medical regimens and your self-care, that you most likely prevented what could have been a hospitalization, and things could have been a lot worse. Thank you both for sharing and teaching us.
All right, I have a few questions from the audience, and we'll read some of the questions that were sent to me, and then we'll allow others to ask themselves. And then this question is for Robyn from Cherish, and she says, Robyn, were you required to change any of your bronchial hygiene or medication regime due to COVID-19? For example, did you have to change from nebulization to a metered dose inhaler out of concern for aerosol generating procedures and risk of viral transmission?
The only thing that I changed, I take a nebulized drug called Palmazine, which thins mucus. I am able to take that twice a day, and so I upped that from once a day to twice. And the only other change I made was I made sure that I cleaned all of my equipment the best that I could. I'm not always the best at that, but I made sure that in terms of the nebulizers that I did thoroughly clean them. My team decided that for the first 14 days, they would not start steroids or an antibiotic. There was anecdotal story from France that steroids could have made the COVID virus worse. Unfortunately, after 14 days, I felt like I was able to get through the hard part without needing any intervention.
All right, and this question is from Emily from Joy, and she says, what is your current regime? What is it that you're currently doing?
So I take, I get an injection once a month of Xolair. I take Singulair and levocitrazine daily as pills. And I take Symbicort 2 puffs twice a day.
Okay, yes. Her follow-up question was, did you stop your steroids? So.
No, so we chose to double up on the Symbicort.
All right. This question is from Jean. Jean says, great stories. Thank you guys very much. I think it's important to realize that exercise and being in the best shape possible is so important, and I was really glad to hear that. My question to the panel is whether you believe that being in really good shape is important for anyone with lung disease, especially for like COPD patients, for example, regardless of your age. Sort of a general question.
Oh, yes, I think being in good shape is important for everybody, regardless if you have lung disease. So I don't think you have to wait till you get sick to start exercising. Definitely that has been the key for me to optimize my lung function.
I would say, if I can jump in, that it is obviously the physical health, which is going to help people, any kind of boosting of immune system and strength to withstand if you had COVID-19. But also coming back to the theme of mental health, that there's such a correlation between good physical health and good mental health, and those two go so hand in hand in terms of adherence to medical regimen, but also ability to withstand whatever horrible infection or virus you are battling.
Dr. Reinke, this is a general question. Much has been written about putting critically, this is for hospitalized patients, about putting critically ill patients in the prone position to aid in their breathing. And do you have any thoughts about the efficacy of prone positioning, and should patients try doing this at home?
Yes. So yes, there's clinical evidence that when people are critically ill and in the hospital, that being in the prone position helps with oxygenation. In fact, many of the teams in many hospitals have a prone, we call it a prone team, where they literally have people coming in that have been trained to do this, to help people get into the position where they're face down, to help with oxygenation. In fact, one of the physicians I work with that was recently in New Jersey was talking about how amazingly efficient the prone team is. It has not been studied, from my understanding, for people to do this at home without some direction or supervision. It sort of depends on what a person's underlying disease may be. So it's usually for people in the hospital in more critical conditions. But yes, it can be very effective to help with oxygenation. I hope that answers or addresses the question.
This other question is, do you have any thoughts about,
yes,
Dr. Reinke, do you have any thoughts about lung fibrosis or other long-term damage resulting from the COVID-19 virus? Or what have you been hearing?
We've been listening to a lot of different webinars and many from our ATS colleagues on the effects of the medical effects and the long-term effects of COVID. And I think there's so many unanswered questions, so I'm not sure I'm going to be able to give you a definitive answer with that, because this is a disease that looks so different than what we're usually looking at. It looks a little bit like ARDS, and it looks a little bit like some fibrosis in the lungs. But it has some clotting disorders to it. So it's really a different, I want to say, ugliness that the top physicians in the world are still trying to figure out. So unfortunately, I still think we have a lot of work to do to determine the long-term medical consequences of this disease.
All right, very well. Siri, do you have any other questions for either of the panelists today, patients?
Well, I find it fascinating that the groups that were considered to be at greater risk, obviously because of pre-existing respiratory conditions, have these success stories. And I will say the cystic fibrosis community certainly was predisposed to be ready for a pandemic, nobody is ever ready, but in the sense of the practices that have become really second nature to our community in terms of infection control. So we already all had Clorox wipes and masks and gloves and completely understand physical distancing because of cross-infection. And I think in the U.S., just in terms of infection rates for the CF community, they've been lower than were anticipated, and of the few, I mean, there's less than 30 individuals, you're in a very small group, Robyn, that have been diagnosed, that there has been one fatality, but most people have made it through with symptoms that were less severe than expected. So I think, one of the lessons is that all the things we have in society right now about physical distancing and hygiene really can translate to prevention. But I did think it was interesting, you raised so many issues about survivor guilt, which is another issue I'd say in the CF community is fairly common. And Emily, I couldn't help but notice that you were impacted by that as well. And I'm just wondering how both of you are coping with it in terms of the emotional, the emotional after effects of surviving COVID-19.
When I start down that path of survivor's guilt, I reframe my thinking immediately to gratitude. Gratitude for life. And then I thought, I've been through a lot of crap in my life. I'll take this. I'll take this easy time from COVID because I've been through a lot. But gratitude.
How about you, Emily?
I think I'm in the same boat. And when I told one of my girlfriends who lives far away that I was feeling better, she started crying. And I realized that not only is it a relief for me, but it's a relief for family and friends who worry about me. So I feel like that's a better way to kind of spread it out and feel like it's good and it's great that I got it early. Mm-hmm. I just feel fortunate and hope other people have the same situation.
Well, yeah, and I really appreciate the fact that you guys were both willing to tell us your stories, and you made a big impression, I think, on a lot of people. You certainly made a big impression on me. But I'm 75. I have COPD, and the people that I know with COPD, many of them are 65 and older. So my question is, have you heard some stories about people with COPD or people who are a little older, and what kinds of experiences have they had?
So I'll jump in quick before the panelists answer. We're planning to do a series of these, and we actually have, we're planning to do one of these webinars with a COPD patient, perhaps before the end of this month, and also a pulmonary hypertension patient, so we'll be able to get some first-hand experiences from those patients who also had COVID. But I don't know if Dr. Reinke or anyone else of the panel have heard anything on the COPD.
Yeah, Courtney, I can speak to that just from the CDC's data. The CDC's data would say that, again, of those patients hospitalized, about 90% had an underlying comorbid condition. And again, 30 to 40% of those with more advanced either COPD or lung condition. So certainly we think that age is a major factor. Predisposed for comorbid lung condition is a factor in how you fare with COVID. And then just your overall health and well-being, as we've heard from the experiences of both Robyn and Emily.
All right.
I have another question, Courtney, that came our way, if I could field that one.
Yes, please, go ahead.
Okay. So the question was specifically around your individual symptoms. It sounded like that as you were trying to, initially you had the COVID symptoms. What would you say was the primary symptom or the distinguishing symptom between your normal lung condition and COVID-19? The thing that made you stop and think, perhaps this is COVID.
Mm-hmm.
So maybe I'll jump in on, for me, the actual lack of cough was unusual. Once things cleared up and I went back to my usual kind of coughing, clearing my throat allergy thing, I realized that it had been missing. So it was, I mean, really my nose had been dry. There had been no gunk coming out of it, which was, I should have picked up on that being pretty different from my usual allergy-induced asthma.
All right, very well.
I think for me, the symptom of running a fever is what alerted me that I needed to get some help, because normally I run lower in temperature.
All right.
I think what's challenging is that so many of these symptoms can mimic pre-existing conditions, right? So it is very, very hard to tease out. And I think, the key message there is open, clear communication with your provider, right, to help sort out. And, I think it's fascinating. So Emily, you were never tested officially for it. I mean, obviously you had it, but so.
I mean, we all know in New York what the numbers are going to be versus what the testing numbers are, because I don't know what it's like now because I'm not focused on it, but through March and early April, it was impossible.
This question is for Dr. Reinke from Christopher's. Have you seen efficacy in utilizing lung clearance therapies?
Yeah, so I'm a big advocate for using lung clearance techniques for patients with underlying lung diseases. I think that, we really try to have people, and I know Robyn and maybe Emily can both speak to this, clear their lungs so it doesn't develop into an infection. So people are having, COVID symptoms and having a more productive cough. I really try to teach my patients, and we do like different clearance techniques, different cough techniques, using nebulizers to help open up the airways so you can expectorate. There's different devices that people can use. So I'm a strong advocate for having the patient become, very activated and involved in their own lung clearance regimen. And depending upon your specific situation, your medical team and nurses and respiratory therapists are really fabulous to teach those techniques.
All right, very well. So we're bumping up against the end of this time here. We put aside 75 minutes, and we have just a few more minutes. But before we move on, I'd like to share just a couple of things with the audience. That the American Thoracic Society is doing an awful lot to try to get information and resources out there for the entire community. As you can well imagine, the ATS scientists and clinicians are working hard on the front lines of this COVID-19 pandemic. So there we have a link, a list of ATS resources that can be found on the ATS's website at thoracic.org/COVID/index. There are links there for what we're doing with our Washington, D.C. office in terms of advocacy, and the 4 ATS journals, statement guidelines that we have, particularly in critical care and ours, that kind of thing. There are resources there for clinicians, and there's an entire list of webinars that are done by the ATS and also by our partners in the patient advocacy community, and those are there as well. There's resources from the ATS chapters and also a place for ATS colleagues to connect with each other where they can speak to each other. I also want to take just a second to sort of highlight a number of the other patient organizations that we work with in the American Thoracic Society. As you heard me say a few seconds ago, we're planning to do a series of these webinars. We have another one that we're going to schedule perhaps in the next 2 weeks or so. We're hoping to speak with a COPD patient who had COVID-19 and also a pulmonary hypertension patient. And so as you look at this slide here, you'll see a number of the other patient advocacy organizations that we work with, from the Hermansky-Pudlak Syndrome Network, of course the Allergy and Asthma Network, Pneumonia, PHOAir, Sleep Alliance, Pulmonary Fibrosis, Scleroderma, ARDS, Sarcoidosis, COPD Foundation, of course, the Cystic Fibrosis Research Institute, Lung Transplant Foundation, the LAMP Foundation, the Tuberous Sclerosis Alliance, and the Primary Ciliary Dysphagia Foundation. So we'll be working with a number of these organizations over the next weeks and months to have more of these patient conversations. And also this will go beyond COVID-19 as well. We'll be speaking to patients about other things as well. in terms of best practices. So before we wrap up, and I know we may have a couple of questions that we didn't get to, but I'd just like to leave floor with asking Robyn to leave us with your final thoughts about our conversations today and what you'd like to tell some of the ATS members and fellow patients.
I think my message for everyone, no matter where you're at in life, make the most of every moment. Make every moment count.
Thank you, Robyn. And Emily?
Just take care of yourself and your loved ones, and we'll figure out a way to get through this.
And Dr. Reinke, for some of the patients who may have been on the call with us today and some of your other colleagues as well, what would you like to leave with them today?
Well, I would just like to thank everyone. I think that this is a learning community, and so we as clinicians would not be here without learning and listening to our patients and partnering with our patients. So I'm just very grateful for that, and for Siri and Tonya for your participation in leading these organizations, and of course Courtney and ATS for sponsoring these. It's so important, our patients' voices.
Thank you. And Siri, on behalf of the CF community, some thoughts for our audience today?
Well, stay the course in terms of infection control, remain adherent to your medical regimen, and also I'm really glad you mentioned all the resources from ATS because they are so helpful, but also just for people with specific disease groups. Almost all of us have updated our websites and are offering webinars and support groups and discussion groups. So please check into each one of these organizations if you have a specific disease that you are needing more information about in relation to COVID-19. We are here for you, and it has really been an honor to be on this panel with Robyn and Lynn and Emily and Tonya. Thank you all, and thank you, Courtney.
And Tonya, on behalf of the allergy and asthma community?
Yes, well, again, thank you to everyone, to the ATS, to Dr. Reinke, to Siri, to Emily, and to Robyn. It's been such a pleasure to be with you this afternoon and to have the opportunity to hear the real patient story, the real personal journey of two individuals who demonstrate what can happen when you maintain optimal control day in, day out. And then when you're hit with the storm of something like COVID-19, you are able to, again, apply those lessons learned and to come out of it even healthier and able to share that story to help other people. So thank you for your courage and your willingness to do that today. And thank you to the ATS for continuing to provide that frontline care for so many patients and families that are continuing through this journey.
So on behalf of the ATS, I'd like to thank Robyn, Siri, Lynn, Emily, and Tonya, and also my colleague, Bridget Burns, who works with me at the ATS Public Advisory Roundtable, and all of my colleagues at the ATS. Look out for the recording of this webinar within 24 to 48 hours, and also look out for more information from the ATS. We'll send out another blast about another one of these events that we intend to do in the next couple of weeks. So again, thank you all for being here with us today, and everybody have a good and blessed day. Thank you, and take care.